Have you noticed a loved one going through subtle but concerning changes over the past year? Many people assume that old age leads to a sudden passing, but in reality, the body often provides quiet warnings months or even a year before reaching its final stage. The challenge is that these early signs are easy to overlook. They may seem minor at first, only becoming obvious in hindsight, when it's too late to prepare or create meaningful memories. This video will cover 5 key signs that often appear in the year before an elderly person passes away. Some of them might be things you've noticed but dismissed as normal aging. Others might seem insignificant but actually indicate a gradual decline in the body's functions. Recognizing these signs early can help you provide better care, make the most of your time together, and ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, as understanding these 5 signs will help you prepare, both emotionally and practically, for what's ahead. When you recognize what's happening, you won't be caught off guard. Instead, you'll be able to make the most of every moment with those you love. 1. Significant weight loss. One of the earliest and most telling indicators that a person may be approaching the final year of life is unintentional weight loss. At first, it might be subtle. Clothes fitting looser, a belt needing an extra notch, or a once hearty appetite beginning to fade. Many families dismiss this as part of aging, but losing weight without trying is rarely a good sign. This often means the body is no longer absorbing nutrients effectively. Muscle mass is decreasing, and essential systems are slowing down. While some loss of muscle is natural with age, rapid weight loss suggests a deeper issue: difficulty digesting food, processing protein, or maintaining overall strength. This decline makes movement more difficult, increases fall risk, weakens the immune system, and leaves the person vulnerable to infections. Changes in appetite are another common factor. Many elderly individuals stop feeling hunger the way they once did. Their sense of taste may fade, food may no longer seem enjoyable, and they might begin skipping meals or eating much smaller portions. This isn't just a matter of preference. It's a physiological shift. As the body prepares for the end of life, it stops signaling the brain to seek food, leading to lower energy, declining strength, and overall deterioration. Underlying medical conditions can also contribute. Chronic illnesses such as cancer, heart failure, or kidney disease often cause weight loss long before other symptoms appear. Even conditions like depression or cognitive decline can lead to reduced eating, creating a downward spiral where the body isn't getting the fuel it needs to sustain itself. While some families attempt to counteract this by offering favorite foods or supplementing with protein drinks, persistent weight loss despite these efforts indicates a deeper process at work. Instead of forcing large meals, focusing on comfort, easy-to-eat foods, and hydration can be more beneficial in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about appearance. It's the body sending a message, and understanding that message can help you prepare for what's ahead with clarity, compassion, and the ability to make every remaining moment meaningful. 2. Extreme fatigue and weakness. One of the most noticeable changes in the final year of life is a deep, persistent fatigue that doesn't go away with rest. This isn't just feeling a little tired after a long day. It's an overwhelming exhaustion that makes even the simplest tasks feel difficult. Getting out of bed becomes a challenge. Walking across the room requires effort, and once routine activities like cooking, dressing, or holding a conversation feel draining. This extreme weakness isn't just a normal part of aging. It's a sign that the body is conserving its remaining energy as organ function slows down. The heart doesn't pump as efficiently, circulation weakens, and muscles don't receive the same oxygen supply they once did. As a result, many elderly individuals in their final months become weak, unsteady, and unable to sustain the level of activity they once enjoyed. Understanding these changes allows families to adjust their expectations and provide the right kind of support, focusing on comfort, assistance with daily tasks, and making the most of the time that remains. A key factor in this process is metabolic slowdown. The body is designed to produce and use energy efficiently, but as it prepares for its final phase, that energy is redirected toward preservation. Instead of fueling movement and activity, the body begins conserving resources. This is why individuals in decline may start sleeping more, needing longer naps during the day, and finding it increasingly difficult to stay awake for extended periods. Some may even experience sudden drops in energy, seeming fine one moment but completely drained the next. Perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Seniors who once took pride in their independence may begin to feel frustrated or even embarrassed when they can no longer do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they've lost interest, but because they simply don't have the energy. This can lead to a cycle of isolation, accelerating their decline as they gradually stop trying altogether. For families, watching a once active loved one become exhausted and withdrawn can be painful. It's easy to assume they just need to push through it, but forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and ensuring their remaining days are as comfortable as possible. If a loved one experiences deep, ongoing fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. In the end, what truly matters isn't how much they can do. It's that they feel loved, understood, and at ease. Another major change in the final stage of life is cognitive confusion or withdrawal. You may notice that someone who was once sharp and engaged starts to forget things more often, struggles to follow conversations, or becomes disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These cognitive changes can begin months or even a year before death. This isn't just everyday forgetfulness. Like any other organ, the brain relies on a steady flow of oxygen and nutrients to function properly. But as circulation weakens and oxygen supply decreases, cognitive function starts to decline. The person may become easily confused, struggle with decision-making, or have trouble recognizing familiar people and places. In some cases, they may experience brief moments of lucidity, followed by sudden episodes of confusion, almost as if their mind is fading in and out. Emotional withdrawal is another common sign. Someone nearing the end of life often loses interest in social interactions. They may speak less, engage less, or spend long periods sitting in silence. It's not that they don't care about their loved ones. Their brain simply no longer processes emotions and engagement in the same way. Conversations become tiring. Loud environments feel overwhelming, and eventually many seniors retreat into their own world. You may also notice changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality shift. It's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations as they once did. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and create an environment that feels safe, familiar, and peaceful. Even when words fade, love and comfort can still be deeply felt. Another clear sign of decline is frequent infections and slow healing. As the body begins to wind down, the immune system weakens, making a person more susceptible to illnesses. Someone who rarely got sick may suddenly start developing frequent colds, urinary tract infections, or even pneumonia. Cuts and bruises take longer to heal, and even minor wounds can become serious concerns. This decline in immune function happens because the body is no longer prioritizing repair and recovery. Energy that was once used to fight off infections or heal injuries is now being conserved for essential organ function. As a result, illnesses that were once manageable can become much harder to recover from, leading to a greater risk of complications. For families, these recurring infections and slow healing can be distressing. It's crucial to provide comfort, monitor symptoms, and ensure proper medical care. But it's also important to recognize that the body is following its natural course. This is a time to focus on making your loved one as comfortable as possible, ensuring they are warm, hydrated, and surrounded by care and love. Recognizing these signs early allows you to provide better support, cherish meaningful moments, and prepare both emotionally and practically for what's ahead. Understanding what's happening helps ensure that the final stage of life is met with dignity, comfort, and peace. As the body weakens, the immune system becomes less effective, making individuals more vulnerable to frequent infections. What were once minor colds or flu now take longer to recover from, and simple wounds like small cuts or bruises heal at a noticeably slower rate. These changes aren't random. They signal that the body is losing its ability to repair and defend itself. One of the biggest concerns during this time is recurring infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as immune function declines. Many families assume these are isolated illnesses, but when they start happening frequently or take longer to clear, it's often a sign that the body is struggling to fight back. Even antibiotics, which once worked quickly, may seem less effective, requiring stronger medications, longer recovery periods, or multiple rounds of treatment for infections that were once minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as efficiently. Another overlooked issue is chronic wounds. If small scratches, sores, or bruises aren't healing properly or keep reopening, it could indicate compromised circulation. Poor blood flow prevents oxygen and nutrients from reaching the skin and tissues, slowing the healing process. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. infections in the final stage of life don't always present as expected. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first warning sign of an infection, appearing even before other symptoms. Recognizing these early changes can make a difference in providing the right support and ensuring comfort. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. The natural instinct is to push for aggressive treatments, hoping that another round of antibiotics or another hospital stay will solve the problem. However, at a certain point, the focus shifts from curing to comforting. Ensuring hydration, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another medical intervention that may only prolong suffering. Another major sign of the body's transition is changes in breathing and circulation. You may notice that a loved one begins breathing more slowly or shallowly, sometimes pausing between breaths or breathing in irregular patterns. Some experience a cycle known as Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes may start subtly but become more frequent and pronounced over time. Weakened circulation is another common sign. Hands, feet, and even the nose and ears may feel unusually cold as blood flow slows. This happens because the body is redirecting resources to essential organs, prioritizing survival in its final stage. These shifts in breathing and circulation indicate that the body is naturally preparing for the next phase, and recognizing them allows families to provide the most compassionate care possible. Changes in breathing, cold hands and feet, or a bluish tint to the skin are signals that the body is conserving energy as circulation slows. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In the final months or weeks, the most valuable thing you can give isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. As we reflect on these signs, significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation, it's important to recognize that they often appear in the year leading up to an elderly person's passing. They may not happen all at once or be immediately obvious, but noticing them is a sign that the body is preparing for its final transition. For families, accepting these changes can be difficult. The instinct is to encourage a loved one to eat more, move more, or fight through exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Instead of resisting the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared. Recognizing these changes early allows for better care, informed decisions, ensuring that a loved one's final months are filled with love and dignity. This is a time to cherish moments, share stories, and remind them that they are valued and not alone. If you're experiencing this with someone close to you, take a deep breath and remember, you are not alone. Many families have walked this path, and while it is never easy, knowing what to expect can bring strength, patience, peace.